Ya'li Madath, welcome, bienvenue. Thank you for tuning in to another Friday Night Reflections. My name is Malika Karim-Rajan, and I'm honored to be hosting our Jamati members, multi-faith family members, and everyone tuning in from across the globe. I'm coming to you once again from Winnipeg, Manitoba, and because apparently I didn't do too poorly co-hosting last week with the Kushali Kahoot, the team invited me back. So thank you very much, everyone. It's been a busy week with all the Kushali celebrations virtually, and right now, around this time last year, like we said, we would have been together, playing dandiya, hanging out, rasra, maybe a music party. And although that's not possible, we are so fortunate to be able to unite like this virtually. Now, I didn't try making sherbet, but after last Friday's programming, my husband did bring this into our house. So apparently we're going to be making some English sherbet at some point. And speaking of my husband, he is quite the cook and made us chicken biryani for the very first time so that I didn't feel homesick. It worked. It was really good. Tasted just like my mom's. I know. Can you imagine I'm giving him that compliment? Don't tell him. It'll go to his head. But I hope you all had a chance to have some festive food of your own, whether it was biryani, sherbet, mantu, jalebi. They're all so good. And if you were brave enough to try something new this Kushali, whether it went well or not, way to go. Congrats. You can add it to your 2020 accomplishments. Now, when we mention accomplishments, this past week, we saw the first COVID-19 vaccines given out to patients in Canada and the US. What a moment of hope and a sense of light at the end of a somewhat dark 2020 tunnel. Looking ahead to 2021, as the vaccine rolls out globally, I hope we'll once again be able to get back to normal. We know that many of you have questions, and it can be confusing to siphon through all the media coverage out there. So tonight, we thought we would bring in some of our own health experts to answer your questions and break things down for us. Thank you to all those who took their time to submit questions, and our esteemed panel will try to answer as many as possible on tonight's show. But before we dive into that, we are privileged once again to have with us this week Council for Canada President Ameerally Kassim-Lakha, joining us from his home in Toronto.
My dear brothers and sisters, Ya'li Madath. As we approach the end of 2020, I would like to take a moment to recap a few events with you from this year. They relate to the strength of our community and how members within it have risen to meet the demands of the period we are in. I want to give you a behind-the-scenes look at the work of our volunteers, some of whom have become invisible heroes through the pandemic. They are the ones whom our beloved Hazimam paid a tribute to in his message to the Jamaat last week, and I would like to speak to you about how these heroes have carried out their work. In January of this year, we started hearing reports related to COVID-19. It was hard to imagine then that circumstances would evolve to where they are today. In January, we understood so little about the disease and weren't sure what impact it would have in Canada. But we asked ourselves, what is the risk that COVID can pose to the Jamaat, and how can we protect the Jamaat? What steps must we take to ensure the safety of every member in our Jamaat in case COVID-19 becomes an issue in Canada? So, we established a COVID-19 multidisciplinary task force whose overarching mandate was to safeguard the health and wellness of our community. This is the team that planned and worried starting from January about how to keep the Jamaat safe. They became the team that implemented our safety and health protocols, planned and managed the reopening of our Jamaat Khanas, the registration system, and allocation of capacity to keep everyone secure. These are the volunteers who established monitoring systems to navigate the ever-changing macro landscape of the pandemic so that we could participate comfortably and safely. In March, we took the unprecedented step of closing our Jamaat Khanas. This was right before Navroz, as you will recall, a time when our community usually comes together to celebrate the New Year. We asked ourselves, with no shared physical spaces, how will we keep members of our Jamaat united and close to one another? How will our seniors find comfort and not become isolated? How will our children experience the strength of our community and not become disconnected? Again, our volunteers rose to the challenge. Within a week of Jamaat Khana closure, our communications team put their minds together to reimagine a forum for our community to stay as closely connected as possible. They mobilized our greatest talents in journalism, production, arts and culture, and many other areas to create Friday Night Reflections, Visionary Voices, and other programs. Their outstanding leadership has kept our Jamaat informed, motivated, and together. Overnight, our board and portfolio volunteers transitioned in-person programming onto digital platforms, inclusive of Baitul Ilm. Under the leadership of the IVC, our Access volunteers were trained within days to support the Jamaat in economic, health, education, and social welfare matters, something which the IVC had not done before. We often recognize the work of our volunteers, and with good reason. I am doing so today because their efforts over the past year have been exceptional. Night and day, our volunteers have been thinking of and working hard for the welfare of the Jamaat. In many instances, they have mobilized the best experts in the country to provide good advice to the Jamaat. These volunteers are constantly preoccupied. They are constantly worried. They are preoccupied with making sure we are cared for and protected. They may be unknown to you, they may receive no recognition, but you know and they know how much they have accomplished in supporting the Jamaat. As a Jamaat, we can pay tribute to the work of these individuals. However, the most important tribute, and the only one that ultimately matters, is the one that has come from our beloved Hazrat Imam. It is these volunteers who he recognized this past week when he said, "For centuries, one of the core backbones of our Jamaat has been our tradition of voluntary service. The global pandemic has challenged our volunteers in many new ways, whether it be in offering care and comfort to my Jamaat and others, disseminating important and timely health information, or producing digital communications content to keep the Jamaat informed and motivated. I am very pleased with the excellent work of my volunteers throughout the world to support the Jamaat and the communities amongst whom they live. And to all my volunteers, I convey my greatest admiration and best affectionate, loving blessings." There are a few additional thoughts I would like to share following from Maulana Hazrat Imam's message last week. First, Maulana Hazrat Imam's guidance on how to approach adversity. As he described, our Jamaat is no stranger to difficulty. We have encountered adversity in many instances in our 1400-year history. Maulana Hazrat Imam outlined clearly how we are to respond and ultimately overcome such circumstances. He highlighted three qualities: unity, resolve, and resilience. Remember these because they're important. Unity, resolve, and resilience. And he reminded us that this approach is in keeping with our historic tradition. Unity in this context is a manner in which we develop our resilience. Unity refers to how we come together as a community and support one another in line with the exceptional volunteer work that I have just described. It also refers to the bonds we share with our friends and within our family. These bonds are precious. They are a blessing and they are to be cherished. At times this may be difficult, especially in the current environment, but our task is to live with kindness and compassion, to be easy and forgiving of one another, and to show love and affection in our every act and interaction. It is in times of crisis that we realize how important family unity is to maintain our resolve and resilience. Family unity is a precious value, one we have to work hard for and treasure. Maulana Hazrat Imam also guided us to one more crucial strength in the face of adversity: the comfort and support that comes from the practice of faith, whether in Jamaat Khanas or by way of private personal prayer. He is telling us to lean on our faith, because doing so will pull us through any challenge we face. Next, Maulana Hazrat Imam indicated that his priority during the pandemic is in ensuring relief and support for those who are most vulnerable. Our volunteers have carried out this guidance in an exceptional manner in the past year. Maulana Hazrat Imam then spoke of our future when he said that he is convinced that our Jamaat will emerge from the present crisis with enhanced strength and capacities. This is a message that he has conveyed repeatedly through the pandemic, and he emphasized once again last week. However, emerging with strength does not just happen organically. It is a function of the unity and resilience mentioned earlier. It is also the product of our individual agency and effort to position ourselves intelligently in areas of promise for our future and the future of those who depend on us. My dear brothers and sisters, I know that many of us across Canada are in isolation, bracing the impact of reinstated shutdowns related to new waves of COVID-19. I know this is not easy. I ask you to remember the expression, "The night is darkest in the hour before dawn." Inshallah, we have a bright future on the horizon. Recent developments related to the COVID-19 vaccine, including its approval and distribution, are positive. If we keep this in mind, put to practice the principles of volunteerism, unity and resilience, and lean heavily on our prayers in times of need, we will in no time, inshallah, find ourselves on the other side, much stronger than we were before. Thank you and Khuda Hafiz.
Thank you, President Saib, for your thoughts and for reminding us how incredible the Jamaat's response has been in supporting each other over the past year. And now, I'm excited to get our topic for today started. Our panel of medical experts include Dr. Irfan Dhalla. He's a physician at St. Michael's Hospital and a vice president at Unity Health Toronto. He's also an associate professor at the University of Toronto, and he's on a number of provincial and federal committees related to COVID-19 pandemic response. His research has been recognized with several national awards. We also have Dr. Tasleem Nimjee with us, emergency physician at Humber River Hospital and pandemic lead for the hospital's COVID-19 emergency response. She also serves on a number of provincial and federal committees related to COVID-19 pandemic response. Dr. Nimjee was named one of the most influential Torontonians of 2020 by Toronto Life magazine. And rounding out the group, we have Dr. Shainoor Ismail, an associate physician at the Metro City Medical Clinic in inner city Edmonton. She's a Royal College specialist in public health and preventative medicine and the former Deputy Chief Medical Officer of Health for Alberta. Dr. Ismail is currently the Senior Medical Specialist with the Centre for Immunization and Respiratory Infectious Diseases of Canada and was featured in the Canadian Medical Association Journal last month for her work on integration of vaccine programs, with her work also being recognized internationally. All right, it's such a privilege to have you all here on our panel, and we're going to start right away. We have a lot of questions from the Jamaat. So the first question that we got was from Al Riaz from Port Moody. He was saying that we keep hearing how the new vaccine testing has been equivalent to the development of other vaccines because the various stages were completed together rather than by themselves at different times, linearly, as he put it. So how are we supposed to know that there is not going to be any long-term side effects for this vaccine?
That's a great question, Malika, and Al-Riaz is absolutely right. The process for developing a vaccine is very long and it's very costly. And in this situation, because of the pandemic, there's been an urgent need for a vaccine. And so there's been significant collaboration and investment worldwide to develop that vaccine. So there's basically 3 stages of development for a vaccine. The first is exploratory, that takes place in a research lab. Next, you have the preclinical stage where testing is done in animals. And then finally, you have the clinical stage where the testing is done in humans. Now, in the case of the COVID-19 vaccine, the genetic code of the coronavirus was published on January 11th. And that really expedited the exploratory phase and allowed scientists to start working on developing a vaccine. Now, once you get to the clinical stage in humans, you have 3 more phases of testing. And with each phase, you're increasing the number of human volunteers in the trials. So by the time you get to the 3rd phase, you're looking at testing in about 10 to 30,000 human beings to make sure that the vaccine is safe, that it's immunogenic, and that it's efficacious. That means it protects people against the disease. And so the Pfizer trial, which is the vaccine that was recently approved for use on December 9th, actually had a clinical trial of 44,000 human participants across a number of different countries from diverse ethnic backgrounds, diverse ages, as well as different comorbidities. Now, if at any stage of vaccine development there's a concern, then the trial stops and the vaccine doesn't go any further. Once it gets to phase 3, Health Canada is the regulatory body that approves the vaccine, and it looks very closely at the data, and it approves it only if it's proven to be safe and effective. Now, after the approval process, there's ongoing clinical trials that's called phase 4 clinical trials. And there's also surveillance of potential adverse events that's ongoing. And with this particular vaccine, it's scrutinized worldwide, so any particular safety signal will be picked up right away and investigated. And there's one more very important step, and that involves an independent scientific review by an expert committee. And in Canada, that committee is called NACI. It's the National Advisory Committee on Immunization. Now, the World Health Organization recommends that every country have a NITAG like NACI, and that group looks at the safety, efficacy, and immunogenicity of a vaccine, but it also looks at the disease, and it looks at the epidemiology and who the risk groups might be. It also incorporates things like ethics, equity, feasibility, and acceptability into a vaccine program. And so just to give you an idea of how things are moving so quickly, the committee, NACI, usually meets 3 times a year. And in the last week, we've met 3 times. So, and this has been ongoing for a number of months where the evidence is being reviewed in collaboration with Health Canada to ensure that Canadians have access to a safe and efficacious vaccine.
Wow. Okay, great response. I think you covered a lot of the areas where people were maybe questioning or wondering how this vaccine got approved so quickly when other vaccines take a little bit more time, and the safety around it. So thank you so much. Our second question is along the lines of the understanding about the vaccine and what it consists of. So one of our questions came in from Sophia in Unionville, and Sophia said her understanding is that the vaccine consists of mRNA. The mRNA, however, does not enter the nucleus of the cell. Could you please, one of you, explain to us how the vaccine works and in general how vaccines work?
So when I think about vaccines, I think about studying for an exam. You know, when you want to do well in a test, you do the practice questions so that when the real test comes, you're very prepared. So a vaccine is like a practice test where it gives your immune system a peek into the question, which is the foreign virus, and then your body prepares itself for the answer, which is in the form of antibodies. So that when you're presented with the real test, the infection, your immune system says, hey, I remember you. And then it uses its immune memory to release the store of antibodies and attack the virus. And so when you're thinking about how the COVID-19 vaccines work, you kind of have to understand what the coronavirus looks like. And, you know, many of us have seen cartoon depictions of a coronavirus, and even my son drew a picture of coronavirus on my birthday card. So I guess you could say he gave me coronavirus. But what you can see is that the red projections are the spike protein. And the spike protein is really important because it's like the key that the coronavirus can use to enter into our body's cells and create all sorts of chaos, kind of like an unwelcome guest. And if you can figure out how to develop that key and get rid of that key, you can get rid of the virus. So in terms of how the mRNA vaccines work, they've been researched for decades, for 30 years at least, but they're pretty finicky. And that's why they need a fat or lipid nanoparticle to sort of stabilize them. And that's why you've also heard that, you know, these Pfizer vaccines need to be put in ultra low temperatures, and there's freezers that needs to transport them and store them. So that the mRNA is kind of like a recipe to make that spike protein. And it teaches the cells the recipe, and then it disappears within days, kind of like a Snapchat message. It's here, and then it's gone once it's done its work. So it doesn't enter the nucleus of the cell, and so there's no harm to the DNA or to our genetic code. It just helps your body make the practice test questions so that we can pass the real test. And it doesn't contain the coronavirus, and so you can't get sick with the COVID.
Okay, wonderful. Thank you. Our next question is around the availability and eligibility of the vaccine. So really about the rollout here in Canada. As we've been hearing this week, healthcare workers across Canada are going to be getting the first couple of doses of that Pfizer vaccine that you had mentioned that needs to be kept at ultra low temperatures to keep its stability, as you explained. Now, for anybody else, the other doctors around here on our panel, you know, how's the rollout going to work for the rest of the Jamaat? If you're not a healthcare worker, where do you rank? When will you be getting your vaccine?
You know, that's a great question. The good news at the outset is that there will be more than enough vaccine for every Canadian. It will take time. It'll probably be somewhere around 9 months probably before everybody who wants a vaccine, and I hope everybody does want a vaccine, has the opportunity to get vaccinated. We're going to start with the people who are most likely to suffer harm from a COVID infection, so people living in long-term care homes, people who are older, and the people who work in long-term care homes and with older patients. And then as time goes on, week after week or month after month, the eligibility criteria will expand. So fairly soon, we should start seeing clinics accepting patients who are not living in long-term care homes, but who are in their, let's say, their 70s and then their 60s. And then hopefully by late spring or maybe early summer, we'll have enough vaccine that the general population can be vaccinated. And just as is the case with most vaccines, the vaccines will be available in a variety of healthcare settings. So I think there was some question about whether people would be able to get the vaccine in Jamaat Khana. That's not likely at the outset, or it won't happen at the outset. Looking forward into the summer, it's hard to predict exactly where the vaccine will be available, but probably by summer, it'll be possible to get the vaccine or one of the vaccines, as Dr. Ismail pointed out, in a number of settings. I think with everybody's interest in the vaccine, it's very likely that we will be hearing about how to get a vaccine, where to get a vaccine, what the registration process will be like through pretty much every communications medium there is. And so, I don't think people need to worry very much that they will miss their turn. There will be enough vaccine for everybody. And when it's your turn, you will hear about it.
Now, the next question is about reactions to the vaccine. We were hearing around the world when the vaccine first touched down in the UK that there was a couple of allergic reactions to the vaccine potentially. So I'd like to touch on this point here. Sucker says that when she got the flu shot, she had reacted with some hives. And so she was asking if she should get the COVID-19 vaccine whenever it's available for her.
So when we think about adverse reactions or specifically allergic reactions in the context of this question, we think about first sort of severe allergic reactions and then more minor allergic reactions. And I think what's important with this question asking about hives, it's the constellation of symptoms, certainly. And what we've heard about when we talked about the example of what happened in UK, and I think there was another case in Alaska this week of a severe allergic reaction or what we would call anaphylaxis. This is life-threatening allergy. We've heard of very few cases of this. And so people that have known allergy to any of the components of the vaccine would, of course, be advised not to take it. And again, these are very rare reactions. And the allergies that we're talking about are to components like PEG or polyethylene glycol. So again, not a common allergy. But of course, if you have a history of an allergic reaction to that, then you would not be advised to get the vaccine. But other than that, if you've had allergic reactions in the past to the vaccine, I think the best advice that we can give you would be that for anybody that's at a point where you're being offered the vaccine, you'll go through a screening process where you'll be asked a series of questions to determine whether or not the vaccine is appropriate for you. And part of that is understanding what the allergic reaction is that you've had in the past to then determine if it's safe for you to have the COVID-19 vaccine.
Okay. Along the same lines, one of our Jamati members had said that she has acute asthma. And so would this vaccine be okay to take if you are suffering from something like that?
Yes. So the vaccine is safe for people with asthma. It's safe for people with any lung disease. It's safe for people who have problems with their immune system. And one way to think about it is, what you're trying to prevent is this disease, COVID-19, and it's a very serious disease. And so even though no vaccine is 100% safe, it is much safer, much lower risk, orders of magnitude lower risk than getting the disease, particularly for somebody who has a lung disease like asthma or chronic obstructive lung disease or somebody who is older. And so, in fact, those are the kinds of people that we really, really want to encourage to get a vaccine as soon as they're eligible to have the vaccine.
Awesome. Following on that, another Jamati member asked if they're taking immunosuppressants, are they able to get the vaccine, or should they be worried about taking it? Should they talk to their healthcare professional?
So that's a really good question, Malika. And the National Advisory Committee on Immunization, which is a committee of independent experts that provide advice to the Public Health Agency of Canada, just released the recommendations for who should get vaccinated just last week. And it's based on a review of the evidence and on the clinical trials, which tested individuals 16 years of age and older. And so NACI looked at who the vaccine was tested in, as well as who was excluded from the clinical trials in order to make their recommendations. And so there were populations that were excluded from the clinical trials or who were present in very small numbers. And so we're uncertain about how the vaccine works in these populations. So one of those populations that was excluded were anyone who was immunosuppressed, either because of underlying disease or because of treatment. For example, cancer patients who are undergoing chemotherapy. Another population that was excluded from the trials were pregnant or breastfeeding women. Another population excluded from the trials were adolescents or children under the age of 16. Now, individuals with autoimmune conditions like lupus were included in the clinical trials, but in very small numbers. And when you think about autoimmune conditions, they're very broad. And so and the spectrum of autoimmune conditions included in the clinical trials was very narrow. And so there's no reason to expect any issues within these populations. It's likely safe and efficacious in these populations, but we're taking a very cautious approach until we get more evidence, especially in the context of a limited supply of vaccine. So really, we need to weigh the risks of severe disease versus the theoretical risk of the vaccine when deciding whether to take it. So individuals who have an underlying condition that puts them at higher risk of COVID-19, of severe disease from COVID-19, like individuals with diabetes or obesity, may be able to get the vaccine in discussion with their healthcare provider. And again, the evidence is evolving very quickly, and the experts are monitoring this evidence, and the recommendations may change. So essentially, anyone 16 years of age and older can get the vaccine. Individuals in groups who have been excluded from the trials or were included in very limited numbers, like people who are immunosuppressed, pregnant and breastfeeding women, people with autoimmune conditions, and also adolescents 12 to 15 years of age and older who were included in limited numbers in the trials, may get the vaccine if they feel that the risk of severe disease from COVID-19 is higher than any theoretical risk of the vaccine.
Okay, so just to follow up on that, Dr. Ismail, we did have a question from someone saying, if they were expectant mother or if they were breastfeeding currently, would it be okay and safe for them to get the vaccine? You touched on that, saying about the trials and the small specific group of people that have been included, and that did include expectant mothers. Just wanted to touch on that, if you felt that if there was no other underlying conditions for expectant mother or a mother that was breastfeeding, would it be safe to get this vaccine?
So in the clinical trials, there were actually women who became pregnant during the clinical trial. So with the Pfizer trial, about 23 women ended up becoming pregnant and getting the vaccine during the trial. In the Moderna trial, which is another mRNA vaccine that we're looking at, there were about 12 women who became pregnant during the trial and were vaccinated. And all of these women are being followed. There has been no evidence of any adverse outcomes in those individuals or any concerns about safety. Right now, we don't have all of the evidence to be able to make a firm recommendation. And like I said, the evidence is evolving very quickly. These individuals will be monitored very carefully, and the recommendations may change depending on what we find.
Okay, wonderful. Thank you. Just a question from one of our Jamati members. They say that they live alone, but their parents are elderly. So their parents will probably get the vaccine before they get the vaccine, before they're eligible. Their question was, would it be okay to see their parents then if their parents have gotten the 2 doses of the vaccine? At what point could they interact with their parents feeling safe if they hadn't got the vaccine yet?
That's a really good question. We know that the vast majority of people who have received the Pfizer vaccine and the Moderna vaccine appear to have protection against severe disease. But we also haven't followed, we don't have, months and months of data yet, or we don't know how long that protection will last. As we learn more, it's almost certain over the coming months that the recommendations will change. And so I think the advice I would give to the person who asked that question is to follow the guidance that people like Dr. Ismail and the other public health physicians in the country are providing. And so as hard as it is to hear this, the guidance for the person who asked that question would still be to take precautions when they go to visit their parents, or to stay out of their parents' household when there is disease transmission in the community.
Okay, perfect. Thanks, Dr. Dhalla. I want to follow up just quickly on that one. We did have someone ask, and you touched on this, that maybe you don't know, but how long will someone have immunity to COVID-19 after getting a vaccination?
Yeah, I don't think we know quite yet how long people will have immunity. Both of the vaccines that we've talked about the most so far, the Pfizer vaccine and the Moderna vaccine, there are actually two injections, and so it's important for people to know that they should get both of the injections. And the second injection is sort of thought of as a booster so that the immunity is longer. Most vaccines that we have put into widespread use do confer fairly long-lasting immunity. So I think most people who know about vaccines, and I'm not a vaccine expert, but most people who are reasonably optimistic that we will have long-lasting immunity from these vaccines, but we don't have the evidence to say that with confidence yet. And so we will have to wait until the data are in before we can say conclusively that people do have immunity for many, many months or years at a time.
Wow, these questions are really good from the Jamaat. I feel like all our doctors on our panel can agree with that, keeping you on your toes, which is great. And it's okay if we don't have the answers. I think that's great that you said to keep in touch with the public health experts, because that's what we've seen a lot throughout this year, a lot of changing parts throughout the whole pandemic, and just keeping up with that. So thank you for being our experts here. We're going to dive into the next question here. It's a question that we've been hearing about droplet contact or airborne contact. So can you please explain to us what's the difference between droplet contact and airborne transmission?
So when you're talking about a respiratory infectious disease, you consider whether or not it's spread by droplets or by aerosols. So droplets are bigger, they're heavier, and they don't travel as far. And they're produced when someone coughs, sneezes, talks, or sings. And they can be spread to somebody who's standing pretty close to you. And the droplet can land in their mouth or their eyes or their nose, or inhaled into their lungs. Droplets can also land on surfaces. So if an infected person coughs on a surface, and then you touch that surface with your hand and then touch your face, your eyes, your mouth, you could get that infection. And surprisingly, the average person touches their face about 20 times an hour, so more often than you would think. Whereas aerosols are smaller, they weigh less, and they hang out in the air for longer periods of time, so they're spread more easily. So diseases like measles are highly transmissible because they're spread by aerosols. Now, the SARS-CoV-2 virus, which is the virus that causes COVID-19, is primarily spread through droplets, which is why things like wearing a mask, physically distancing, and hand washing are very critical.
Okay, perfect. Thank you so much. The next question is from Ulner in Coquitlam, really talking about the mental health aspect of COVID-19 and this year. So his question is, COVID is a big impact, and potentially we're not all feeling the same normal life that we used to have, and that's having some adverse effects on people mentally. So what can you say for those Jamati members out there that are maybe feeling blue right now? It's been a tough year for them, to help them stay the course and listen to public health mandate.
So I think, first of all, the response from all three of us, I'm sure unanimously, would be you are not alone. People are feeling this everywhere, healthcare workers included, us included, across communities. And so the first message should be that you are not alone. And this is the time in the pandemic where, we often say people are really having to dig deep because people are fatigued. And time sort of makes you feel like you're getting a bit worn down because you've been sort of following measures for a prolonged period of time, really missing the people that you're used to having close close connections with. And so now is when you are sort of really having to dig into yourself and sort of have that extra added bit of resilience. But remembering that we need each other. Connection is extremely important and vital. And so we've had to get creative in the ways that we do that. Friday Night Reflections is a wonderful example of that. And our recent Saligra Kushali celebrations is a great example of that. And I think I heard from a lot of people really some sort of almost just not feeling as excited as they typically might around Kushali, feeling like it wouldn't be the same, and then almost pleasantly surprised at the creative ways in which family managed to come together, or friends support each other, or the Jamaat really come together around shared events like the events over the weekend. So first of all, I think the message is to say that you're not alone. Second, it's to say reach out, asking for help or asking for connection, and admitting that you might need something from somebody else often takes a tremendous amount of courage. And it's hard to show vulnerability, but that actually is strength, and we need to be better at doing that. And sometimes it takes leaders around us to share their vulnerabilities for us to feel like we can show ours. And so myself included, and I'm sure my colleagues would agree, that we've all had moments where we've been feeling particularly down, or feeling like, can I keep doing this? Can I slog through another day of this? Or I really miss my friends. I really miss Jamaat Khana. We're all feeling it. And I would say that now is, a really exciting turning point, that feeling that, the end is not as far away as it was months ago. It's a bit more palpable as we start with vaccines this week, an exciting moment in the country. So if getting access to a virtual visit isn't something that you can do on your own, leverage Jamati access lines, leverage resources within the community so that we can help you to do that.
Another question from Toronto from Nassim. She says, if someone has tested positive for COVID-19 and is recovering, and they're about 95% good again, do they need to sanitize their apartment so that COVID does not come back? And what other measures do they need to take?
So I think now, and what we had said earlier, really in terms of really following public health guidance, would again remain true, and will continue to remain true through this pandemic. So at this point, we've talked about some folks that if you've had a COVID-19 infection, is there a possibility that you could get an infection again? So there's that, and we know that we can't say with 100% certainty that you may not get the infection again. And so we would advise that even if you've had the infection, you're still going to follow public health measures. You're still going to wear a mask, stay away from crowded spaces, and wash your hands. And again, you're doing that to keep yourself safe as well as to keep those around you safe. And then the other piece of that is in terms of sanitizing your home. So you're doing that again to keep your home free of pathogens. But again, if you're in a shared space, that becomes even that much more important, again, to keep those safe around you. And then finally, I would say, it's really hard with sort of saying, I feel, 95% better, or I think I feel almost back to myself, or 70% better. It's really hard to quantify what that actually is. And so again, we generally say that when it comes to when somebody is at least having to practice isolation, we look at 14 days from the date of symptom onset as being the guidelines. And so I would encourage people to really follow that kind of methodology, as opposed to trying to say, do I feel almost better, or do I still have some symptoms? You really should be really counting those days and monitoring that to be able to follow the guidelines properly.
Wonderful, thank you. Our question is coming from Arissa in Toronto. She's saying, is it more protective to wear 2 masks as opposed to just 1? And I'm going to add on top of that, what is an effective way to wear a mask, and what do you need to look at in your masks?
Great question. So, it seems intuitive that if 1 mask is good, 2 masks would be better. Actually, what Health Canada recommends is a 3-layer mask. So 2 layers of fabric and then a filtering layer between the 2 layers in a single mask. So one way to think about it is you really have 3 masks in one. So what I would encourage people to do is when they're buying their masks, to look for those 3-layer masks and put one of those on. And if you do that and you have a well-fitting mask, and that's important, and that goes to your question, Malika, about how do you put a mask on? What you really want to have is a mask that covers your nose and your mouth and your chin. And so sometimes you'll see people wearing a mask below their nose. That's not what we recommend, because the viral particles can still escape out of the nose, or you can breathe them in through your nose. So you want a mask that covers your nose, your mouth, and your chin. You want it to be 3 layers, and you want it to fit well. You want it to fit well partly so it doesn't bother your ears, and partly so that you're not fiddling with it all the time. You're not feeling like you need to take it off. And a comfortable mask you should be able to wear for many hours at a time, still breathe, still have a conversation. And that's another challenge, that if people are wearing 2 masks, sometimes they're so tight that then they can only wear them for a few minutes. They feel like they're suffocating. And so 1 mask that fits well, and ideally 3 layers.
Thank you. We touched a little bit about this when we were talking about mental health, but the question is out there from Hanif in Ottawa. How has the pandemic affected your motivation to work in healthcare? Now, this question is for everyone on our panel here. So let's start with Dr. Ismail, please.
Oh, that's a good question. Hard to answer because it's affected us in so many different ways. It's affected me as a mother, with my children being home from school and concerns about them going back in person. It's affected me as a daughter because I'm worried about my mom and my mother-in-law. It's affected me as a wife because I'm seeing my husband a lot more. We're spending a lot of time together, and it's been a balance between work and home, and work has been very challenging, where we're not sleeping, we're not eating, we're not seeing our families as much as we'd like. I work in an inner city clinic in Edmonton, where I see marginalized populations who have been tremendously impacted by this pandemic. They've lost their homes, they've lost their jobs, they've lost their families, and many of them are turning to drugs and alcohol to find comfort. So it's tough to balance all of the different roles and try to do your job well in various different settings. And I just feel very lucky that we have our community and our Jamaat and our Imam to guide us, and that I have a wonderful family for support. And I hope that we can draw on our strengths as a community and as a Jamaat to get through this difficult time together.
I would agree, like my colleagues, the impact to us is all personal as well as professional. If I had to answer that question very simply to say, has this pandemic motivated me in such a way to feel that much more passionate about what I do or committed to what I do versus the opposite? I don't think I would hesitate in saying that it's made me more committed to what I do than ever before. Each of us has the privilege of contributing to our society in our own unique ways, and I guess this is mine. But we also, all of us in our community, share in many things, but certainly share in that we've had modeling of this in the concept of seva from the time we were young children. And so when faced with, in wave 1, the recognition that as an emergency room physician, I would be doing high-risk procedures on patients and thinking about my own vulnerability and what that would mean for my family and for my children and my parents and the like, you have those fears, absolutely. There's no doubt about it. But there's something in you that instinctively just says sort of you roll up your sleeves and you dive in because it's what you've learned, it's what you've seen, it's what you've been doing. And that ethic of serving those around you and of the greater good outweighing the individual is just one that our community espouses so strongly that it's just what we've seen, it's what we know. And I'm grateful to be able to leverage that learning and take that into my job.
I think all of us can agree with that, the instilling of the work ethic and the volunteerism in our community. Thank you. And Dr. Dhalla, last but not least.
I would definitely agree with Dr. Nimjee and Dr. Ismail that the pandemic has affected each of us differently in the Jamaat, in community at large, and even in healthcare. there are definitely some healthcare workers who have suffered a lot. Some who have suffered, paid the ultimate sacrifice actually during the pandemic and lost their lives. And the three of us, I think, are all very privileged. We're privileged every day, even before the pandemic, to have a good job where we can help people be healthier. And the pandemic has reminded us all, I think, that health is actually the most important resource we have. And so for that, I'm very grateful. We have three doctors on this panel, and it's probably, in some ways, it's easier, I think, to stay motivated if you're a physician and you have that position of privilege even within the healthcare system. And I think it's important to recognize, particularly since the pandemic has had such a devastating impact in long-term care homes, that some of our colleagues, healthcare professionals working in long-term care homes, have really suffered immensely during the pandemic. And, really as a country, we haven't done well by those people working in long-term care and the people living in long-term care homes. And I hope that over the months and years to come, we learn from this pandemic, we take better care of the older people in our society and the people who care for them.
Thank you so much, all three of you, Dr. Ismail, Dr. Nimjee, and Dr. Dhalla. Thank you so much for being part of our expert panel. We are so privileged that we have such intelligent people through our community that we can lean on for this advice. So thank you all for being with us today. We really appreciate it. Thank you so much to our panel for sharing their answers to those questions. I hope you enjoyed it and perhaps learned something you weren't sure about. As always, but especially in these trying times, we're lucky to be able to reflect on Maulana Hazrat Imam's words as a source of strength and direction. The Talika on the occasion of the Imam's Salgira Khashali brought us all hope and happiness, but also a reference for guidance. In the Talika, Maulana Hazrat Imam said, quote, "I would like my Jamaat to be guided by the advice and directives of their health authorities, to benefit from the protection these vaccines will provide," end quote. And now we go to our next segment, Reflections from the Front Lines, where we will hear from some voices from those who have been tirelessly working to keep us safe during the Enjoy.
Yalmadat everyone, I am Sawela Ashuri from Montreal. I am currently working at the emergency department of Royal Victoria Hospital Glenside as a nurse clinician. The most difficult part of this COVID pandemic for me is for sure being at the front line, but also having this very disturbing thought of bringing the virus home to my family.
My name is Karim Ali and I am an infectious disease physician. I am from Niagara, Ontario. A challenging thing that I remember from my time being on the front line for COVID is when one of my colleagues was diagnosed with COVID-19. At that time, hospitals and much of the province, and I think almost all of the country, was in lockdown. I remember keeping in touch with my colleague, making sure that the oxygen is good and they are able to breathe properly. I would never forget that call in the middle of the night when they said to me that they are having a difficult time breathing and they don't think they're gonna make it through the night. At that time, we were able to call for help, get them to the hospital and into the intensive care unit. Thankfully, they did okay.
My name is Dr. Alim Nakji. I'm a family doctor and an emergency medicine doctor in Hamilton, Ontario. I work at McMaster University, and I'm also Hamilton Jamaat Khana Mukhi Sahib. The COVID pandemic has been really challenging. We've seen the impact it's had on families. It's made visits difficult. It's torn us apart. On a personal level, we were expecting this little one at the time, so it meant not being able to attend ultrasounds and appointments with my wife. I remember patients coming into the emergency room and speaking about the loneliness and isolation they felt. They described the fact that they hadn't seen any family members in many months, and they talked about the struggles that it took on them.
I have been a nurse for 6 years, and when an emergency would happen on the ward, our first instinct as a healthcare professional is to jump in right away and help the patient. But that has changed. We need to stop and back up and protect ourselves first. We need to apply full protective equipment before entering any patient room, COVID or not COVID. And that's challenging for us because our first instinct is to jump in and help the patient right away.
The most difficult aspect of this pandemic that I can think of is the sheer amount of lonely death that we see when we take care of patients with COVID. Oftentimes, they don't have their loved ones with them to say goodbye or to say a prayer with them. A lot of times, we have held our phones with families over FaceTime to help them say goodbye. Also, one of the most difficult aspects has been the toll it has taken on the families as well as frontline healthcare workers who have been at this since most of this year.
What has inspired me during this crisis is how united we are as one Jamaat. Even though we cannot see each other physically in our Jamaat Khanas, we're still connected. We're still connected through social media, through Friday night reflection, through webinars.
When I'm on the front lines and I'm feeling the burden and I'm thinking about how difficult this year has been for all of us, I'm reminded of the guidance that Hazrat Imam gives us when he talks about the importance of education, not being for ourselves, but for being an opportunity that we have to contribute to others. And that's a source of great strength and a source of great inspiration. That around the world, there are all these healthcare workers that are standing together, using their education for the betterment of the global Jamaat.
An inspiring thing that I remember from this time is how everybody, not just frontline healthcare workers, but also the broader community came together. We followed the rules. We made sure we took care of each other. Everybody is safe. And what has not ceased to amaze me to this day is just the human ingenuity and the scientific progress that we have made, with lots of sacrifices that still continue, but lots of scientific progress that has been made. Last year, this time, we did not even know about this virus. And today, we have a large number of people that are starting to be vaccinated across the world. And inshallah, this is also coming for us here. The next few months for us are going to be extremely difficult. We are already seeing not just the numbers starting to go up, but also the hospitalizations, the deaths that are also starting to go up again. I think these things are a bit different than where we were in March and April. But again, I think it is going to be a difficult winter ahead.
My advice to the Jamaat is, even though we're hearing about vaccines arriving, we still need to continue follow public health guideline, which you all heard about: physical distancing, wearing a mask, and washing your hands regularly to protect ourselves and our loved ones.
There's optimism, there's hope. Hearing Hazrat Imam's words, his feedback that there might be a potential vaccine, that there might be therapeutics that will change the face of the world, it makes me excited. Perhaps we have in front of us a cure. The vaccine presents a real opportunity for life to return to some type of normalcy. It also means that perhaps we don't have to come home with the same fear as providers, worried of what will happen if the virus affects our own families. I'm hopeful, I'm optimistic. Maybe it means a return to normal Jamaat Khanas and normal celebrations, so that we can be together once again without masks on, close by, so that we can spend those moments with our family, those moments that really matter to us.
जमात को मेरी एडवाइस कुछ नेक्स्ट कुछ महीनों के लिए ये होगी कि ये महीने हमारे लिए थोड़े मुश्किल होंगे क्योंकि इन्फेक्शन का रेट इंक्रीज होता जा रहा है एंड ऑल्सो इसके साथ साथ बहुत से लोग अब हॉस्पिटल और आईसीयू में भी एडमिट हो रहे हैं। इस वक्त बहुत इम्पोर्टेंट है कि हम लोग एक दूसरे से 2 मीटर के फासले पर रहें, स्पेशली उन लोगों के साथ जो कि हमारे घर के अंदर हमारे साथ नहीं रहते। मास्क पहनना और दूसरा हाथों को हैंड सैनिटाइजर से या पानी से अच्छी तरह से साफ रखना।
I know it's been a long, difficult road for all of us. It's been a long year, but we cannot be complacent. Remember the responsibility we have for other members of the Jamaat. You may be young and healthy. You may be older with medical problems, but all of us have to look out for each other. And what's beautiful about this crisis is that we can all play our part. And we must look to our history and see what Ismailis have gone through in the past. We've migrated, we've emigrated, we've hidden, we've struggled, we've fought. And all those examples remind us that when the community comes together, it is the strongest. I would leave the Jamaat with words of encouragement to reflect on the words that Hajj Imam himself gave us. The message of hope, the message of optimism, and inshallah, a bright future ahead.
It was so great to hear from all of those voices. Our thanks go out to all of our frontline workers and volunteers who have worked tirelessly to protect and care for all of us. Thank you. And a reminder to those watching who work in healthcare, the biannual Ismaili Healthcare Professionals Registration Drive is currently underway. Allied healthcare professionals as well as healthcare workers from all disciplines are encouraged to register and be part of this national database. Registered members will receive regular updates on regional, national, and international programs, as well as information on volunteer opportunities. The COVID-19 pandemic serves as a stark reminder of the need for all of us to come together and support one another. So please register on iicanada.org if you haven't already. And as Friday Night Reflections has become a staple in many of our houses, don't miss next week's show for our special on the commonalities and shared traditions of the Abrahamic faiths. Now, if you need a refill on your chai, this is the moment to do it because we're getting into that part where we get to all bob together and enjoy some wonderful music. So head on over, grab that chai, and come right back. And as a reminder that if you've missed past episodes of Friday Night Reflections, you can now find them easily at iicanada.org/FNR. And now, for some entertainment as we end our show always with musical expressions. Definitely one of my favorite parts each week, seeing the immeasurable talent in our Jamaat is absolutely awe-inspiring. As always, it's been a pleasure to be your host today. I hope you enjoyed the program. Yali Madath, everyone.
Some people wonder, what's the world coming to? Their days are empty of all the hope that they once knew. We're of the people with faith, this will pass if we dare to do our part. And we will rise as the shadows fall, together fight although we lost. Our hopes and dreams will carry us. So come on now, walk with me, oh, 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 walk with me. Come on now, walk with me, oh, walk with me, oh. Some people ask, what difference could I make? One act of kindness cannot undo the world's mistakes. We're